Posterior pelvic tilt is postural condition in which the pelvic tilts backward, causing lower back to become flat or rounded, rather than maintaining a healthy, natural rhodoric curve. This condition is made by multiple different factors like bad posture that applies continuous unnecessary pressure to the spinal joint, hip or muscle imbalance caused by anything related to daily habit or bad workout plan without concerning muscle balance, or other soft tissue matter like fascia, muscle shortness, and lengthened muscles, and so forth. This condition can lead to pain and discomfort in the lower back, hips, and knees, as well as affect overall body posture. First, let's talk about the characteristic of posterior pelvic tilt. In the posterior pelvic tilt, the natural forward curve of the lumbar spine diminishes or reverses, resulting in a flat or even backward appearance in the lower back region. If you have this condition, hip flexors have to be over-tightened during sitting time to stabilize your lumbar and pelvis. As a result, sometimes patients feel significant tightness and pain from sitting to standing. Individuals with posterior pelvic tilt often have weak and tight core muscles, particularly the abdominals and gluteal muscles are tight, which are important for maintaining proper pelvic angle. Especially the front region of the core should be stretched to normal length. On the other hand, lower back needs to be stronger. In many cases, people with posterior pelvic tilt have tight or overactive hamstrings and hip flexors. These two abnormal tight musculature pattern will give people hard to make hip flexion and extension at the hip joint, which makes people hard to perform normal movement at the hip and lower back. Due to the pelvis's shifted position, the overall body biomechanic and gait patterns may be affected, which can lead to imbalances and inefficiencies in movement. The patient might experience occasional low back pain. Usually the frequency of episodes is increasing over time, and the pain level might stay longer and increase as well. Patient pain level generally decreased after resting for a few days to a few weeks, but subluxation and muscle imbalances is still there. This means your joint is not moving in a designed way, which increased unnecessary stress on your joint, and most likely nerve pressure from your spine gets worse as you have this condition longer. Accelerated joint degeneration takes place. In individuals with chronic issues, not only the lower backs but also hips and knees. How are hips and knees affected by the pelvis? That is another topic we need to cover in depth in the future. Back to the posterior pelvic tilt, here is something that you can do for posterior pelvic tilt as far as exercise perspective. Strengthen loose and overstretched muscles like quadricep and lower back muscles. Stretch tight muscles. Regular stretching using static, eccentric, or with motion carefully in the hamstring, gluteal muscles, front abdominal muscles, and hip flexors, which may contribute to posterior pelvic tilt. Ergonomic assessment. Evaluate your workstation and seating arrangements to ensure proper support and positioning during long hours of sitting. If your body is not fit the one you're using now, your body will be changed to your workstation. It is better if your workstation fits your body, not the way around, I promise. Be aware of your muscle balance. It is better to know which muscle group easily gets weaker in your body. Depending on your work environment, things you do every day or workout, it can be varies. Massage therapy. In many cases, massage therapy can help release tight muscles, accelerate rehabilitation processes. Only if patient uses massage in a proper way. I cannot emphasize enough this. Massage should be done to the shortened and tight muscle group. I see the patient all the time with the damaged muscles by massage to the wrong muscle group. So I hope you find qualified massage therapists. Avoid long period of inactivity and remember to stand and walk and move regularly throughout the day. This can prevent muscle from becoming too tight or weak, contributing to posture issues. Essentially, all of the long, prolonged static posture will give you some level of adaptive shortening. For sure, it is better to have some movement for your body if you can. Professional guidance. Consult with healthcare professional or professional trainer to receive a tailored treatment plan and exercise guidance. Now let's talk about the cases that cannot be fixed by corrective exercise only. Our body is extremely resilient, but if our body passes a certain threshold, our body cannot recover by itself. It needs help to recover at this point. Your body must give you years of chances to correct it or fix it. Everybody naturally realizes nothing is small enough to ignore in our life. As you expect, our body is not that much simple. Here's why so many cases are failing to correct this condition. If the muscular correction doesn't really change the problem in a positive way, either pelvis or lumbar or both subluxation is playing a core factor. If there is a subluxation on the lumbar spine, especially with large amount of backward subluxation, it must prevent lumbar extension and press the back side of the disc on the lumbar spine. If the patient's cases fall into this category, the lumbar extension itself would be limited. If patient is forced to extend backward, it will create even more disc pressure in the back and increase pain. Another case is pelvic subluxation. If one or both ilium is subluxated in the position of anterior superior ilium or internally rotated ilium, or both, this position itself changes the center of the gravity of the pelvis backward, so the lumbar spine has to be flexed to forward to counterbalance. The last case of the pelvic subluxation is related to sacrum. If the one side of sacrum is posteriorly moved too much, or the base of the sacrum is subluxated backward, just like the subluxated lumbar spine, it will create a counter-nutation of the sacrum. It will definitely limit lumbar extension and extension of SI joint. If you have this problem, the muscular correction will be less effective or almost not work. Gonstead Chiropractic is designed for correcting this spinal subluxation. If you want to find a Gonstead chiropractor near you, check out gonstead.com. They will check you with thorough examination and analyzing x-rays. It is crucial to note that the severity and characteristic of posterior pelvic tilt can vary among individuals. Treatment and management often involve a combination of strengthening exercises, stretching, and correcting subluxation in your spine or your extremity. Correction strategies guided by the healthcare professional or fitness trainer. They must be able to provide personalized guidance based on your individual needs and ensure that your approach is both safe and effective. Most importantly, they will save your human time. I hope this information gives you better understanding of the human pelvis. Till next time, be stronger every day.